In today's Octane live session, we are going to look into our post-operative physical therapy treatment for a client who underwent shoulder surgery for his rotator cuff. I am Corby Sanko of Octane, and if you like the videos we put out and you want us to keep on doing these types of videos, please like this video and share it to a friend. Our patient here, who has an initial of RM, came into our clinic after undergoing an arthroscopic rotator cuff repair 2 weeks prior his surgery. During our discovery phase, where we get to know the client, he told us that his shoulder started to hurt from lifting weights in the gym. He thought that it was just a normal muscle soreness that would go away through time. He continued his normal routine and noticed that his shoulder is progressively worsening up to a point where he cannot lift any longer because of pain. His shoulder also throbs even though it's at rest and he's not using it. After a few days, he did an MRI to check what's causing his shoulder to hurt and found out that one of his rotator cuff was torn. His MRI finding were then confirmed by an orthopedic doctor, and surgical repair for it was suggested because of the extent of the damage. He did the surgery, and the surgery itself was a success. He did 2 weeks of pain management, medications to avoid infection, and was put into a sling to protect the shoulder and for it to heal properly. His shoulder felt okay, and now he doesn't feel a throbbing pain on his shoulders at rest. As soon as he came into our clinic, we started by checking first the other joints of his body. This includes his spine, wrist, forearm, and scapula to check how it is moving. It is important to assess how the other joints of the body is moving for us to be able to integrate the movement of the whole arm altogether with the shoulder. After checking, we then found out that his neck is stiff and the forearm movement is quite limited. We then assess his shoulder range of motion to get a baseline starting point. Our initial goal is to safely get his shoulder forward movement and external rotation to 90 degrees. Range of motion is our main priority. This followed by slowly getting the strength of his grip, scapular muscles, and rotator cuff. With post-operative cases, as the range and strength goes up, the pain decreases. For the treatment, we are now currently doing some manual therapy work on his arm to give sensory input on the shoulder as preparation for his movement exercises. We're also doing some manual therapy work on his forearm muscles to open up the joint and release its restrictions. We then proceed by doing stretches on the shoulder itself. It is a very painful procedure, and I recommend you to get someone good to do it for you. It must be done very carefully, and the applicator should be able to sense the shoulder joint and feel so as to not overstretch it, thus causing more harm. After the painful stretches, we then proceed in actively moving the different joints in the body from the fingers all the way up to his shoulder. These are all very simple exercises that can be taken at home to improve the range of motion. Exercises uses tools such as a simple stick to assist the shoulder in movement. The goal is to get the shoulder to forward flexion and external rotation. Additional exercises to improve range of motion of the other joints, such as neck stretches and forearm rotation, was applied to prepare the shoulder joint for early integration. After working on the mobility, exercises to improve strength of the shoulder was given, including rotator cuff strengthening and scapular muscle strengthening. This should be initiated as early as acute stage. Our main goal at this stage is to protect the tissue, control inflammation and pain while slowly increasing his range of motion after a post-operative stiffness. It is important to not overstretch the tissue at this stage to avoid future complications. A friendly tip from us for you to recover your shoulder function Faster is to incorporate the other joints in the body as early as possible, keep an eye on your range of motion, and most importantly, to take things slow, especially during the acute stage. Respecting the chronobiological healing time of the shoulder is key to avoid complications in the future, thus having a smooth recovery and avoiding long-term complications. Rehab after shoulder surgery is never an easy road. It takes patience, consistency, and diligence with your exercise. Having a physical therapist that you are comfortable working with is key and important to help and guide you to a complete recovery. This actual video was recorded a month ago. As of today, the client can now lift his shoulder more than 90 degrees. He has now ample strength on his rotator cuff, and his shoulder is not hurting anymore. He's now on his road to full recovery and can now go back to lifting weights without any pain and discomfort. Future exercise progression includes progressive strengthening of the rotator cuff, close chain exercises of the shoulder, and shoulder proprioceptive exercises. It is followed by some power exercises and some return to sport or return to lifestyle specific movements before we can discharge him completely. Following a sound exercise program along with the help of a good physiotherapist or physical therapist can definitely help you get back to that previous lifestyle that you've been wanting to do. Of course, it will take patience and a lot of hard work on your part, but it's possible for you to get back to that previous lifestyle that you've been wanting to do ever since that injury happened. Another thing to consider is the mental aspect of it, making sure that you are also psychologically ready to get back to that sport or to get back to that lifestyle. Over and under confidence can definitely be detrimental for you. Questions still arise whether someone who has a painful shoulder need to undergo a post-operative surgery or just need to do a physical therapy. Again, it depends on the injury or the problem that you have. If it's a rotator cuff tear, it depends on the extent of the damage. Like more than 50% of tear could be potentially get worse for you, so surgery might be recommended. Again, it depends on your physical manifestation or physical presentation, so it is best for you to ask an orthopedic surgeon or an orthopedic doctor to have your shoulder checked, just for us to know what's the best possible outcome for your shoulder. Now guys, if you have any questions about shoulder pain, rotator cuff injury, feel free to ask us questions in the comment section down below and we'll be happy to answer your questions there. Not all shoulder pains are the same, so it is most important for us to be able to do a physical examination and some subjective history taking for us to get to know what's probably causing your shoulder to hurt. After that physical examination and appropriate treatment to help you improve your range of motion and your strength back is going to help you decrease that pain and improve the longevity of your shoulder. Again guys, exercises or movement is medicine. As long as you keep on working on those shoulders, doing the exercises to help you improve, and it's the correct exercise for your specific diagnosis, you can expect good outcomes from physical therapy. Again guys, our mission here in Octaren won't change. It's to improve the way you move and help you decrease your pain so you can live life pain-free and do all the things that you love to do. And to book a session with us, you just have to click the link in our profile bio so you can start your own premium recovery journey. Again, I'm Gorby of Octaren, and if you like this video and wanted to learn more, please subscribe in our channel and also share this video to your friend. Thank you so much for watching and thank you so much for listening. See you guys on our next video.